So I went and I got a real IV, took the needle out, and then put the IV catheter like on her bear and was just demonstrating it on the bear. The tears legitimately just turned to curiosity, and she wanted to play with it and she wanted to practice on it. And then I was able to do her draw so easily. And I know for a child life, that's your whole job. But it's interesting because in peds nursing, you don't really get taught how to play.
Hey friends, welcome to Child Life On Call. My name is Katie Taylor. I am a mom and I'm a child life specialist. If you're listening to the podcast today for the first time, welcome, and we want you to know that the conversations we have here are designed for parents whose child has received a medical diagnosis. I know it may feel extremely terrifying and world-changing even, but you're here now, and you're about to hear from another parent who has had the same feelings that you do right now, and they're still standing. They had the courage to come here and share what it was like for them, to hopefully make it a little bit easier for you. I'm so grateful to each and every guest and each and every listener who shows up here, and it's my privilege to host this sacred space. Hello, my friends. I'm so happy to be with you today. I'm going to do a super quick introduction so we can get straight to my conversation with Mary, but here's what you need to know about her. She is a mom, she's a pediatric nurse, and she's also the innovator behind the butterfly pig, which if you are a child life specialist, you know exactly who the butterfly pig is. They create mock-up toys that look exactly like medical equipment, and I love Mary's story. Let's go ahead and jump right in. I could not be more excited. I have had my eye on what you've been creating and building over the past probably year really intensely.
Mhm.
And the fact that you will come on the show and share your story and your why and all of the goodness that you're putting out there into the world in terms of play and reducing medical trauma, I'm so grateful to have you. So would you do me a favor and just introduce to our listeners who you are, where you come from, a little bit about yourself?
Yeah, thank you for having me on here. I'm a nurse by training. I started my nursing career in pediatric oncology. And then I also did some time in like a burn ICU for peds. And then the majority of my career was being like a nurse navigator of sorts for adult oncology patients. So mid pandemic during the maternity leave that I had, it was really perfect timing for me to kind of start this business, which came to fruition back when I was on a peds oncology nurse, but I didn't actually have the time to do anything until I had more time at home. So during that time is when I really started doing this as a hobby of sorts. And it just slowly progressed into what it is today. And I quit nursing in mid 2023 to focus on this full time. So it's been a really nice way for me to still be connected to the medical community, to peds, and to be a mom to my kids more because that was the hard part for me with nursing is you have longer shifts and it's really hard to balance the work-life balance. So this business has kind of helped me in my personal life, but then is also been so fulfilling for what we're doing.
That's
That's
incredible.
incredible.
And tell us about your business. So, what is the butterfly pig?
Yeah, the butterfly pig is, we really are on a mission to reduce the trauma of pediatric healthcare for everybody involved. So that involves the children, obviously, with us by making these tools. They're realistic mini medical devices, basically, that are very interactive and educational. So children can learn about and process their unique medical experiences through play, but then it also is really valuable because it empowers the parents to be more involved in education and preparation. And then it saves time for the staff. So we're trying to come at it from all these different angles because as a pediatric oncology nurse, I burned out kind of quick. So I truly feel like if I had resources like this, I might still be bedside because it really is reducing the trauma for everybody. Pediatrics is hard, you know that. It's tough
Yes.
mentally, so we're trying to ease that.
Oh, wow. And the angle I love is too about your goal of empowering parents because that's something that speaks to me too. And I wish I could go
Yeah.
back and tell my child life specialist self 15 years ago when I was starting out how integral it was to have the parents feeling supported and empowered and involved.
Yeah.
And I feel like the tools that you're creating, these like very realistic toys that are just so fun to look at and play with and so accurate. It gives nurses a tool, it gives child life specialists tool, but it gives parents tools to play as well.
Yeah. And that's where I think there's so much research coming out with medical play. And it shows like even parents being involved with educating their kids, there's all these benefits. And the hard part is the term medical play is just like so intimidating to parents that aren't familiar with the medical field. So I do think having stuff like this makes it more accessible to them. So it's not like, oh, I have to know all this in order to create these materials. It's, oh, here's a toy. Let's just openly play with it. And it's just like a easy access point.
It's my soapbox. When I was starting out as a child life specialist, it was like, "Oh, I'm going to go do medical play," and it felt like this big event that you needed a ton of preparation for.
Mhm.
But the word play in itself has to be intrinsically motivated. So in
Yeah.
order to play, like, the child has to be enjoying it and engaged and really the leader of it, and I
Hmm.
think it's like anything with kids, you can walk in there with what you think is gonna happen and what you're going to accomplish, and then they can take it to another level, and it just can become so
Right.
imaginative.
Yeah, I know. And that I think that's the best part about like working with kids and these types of tools too is that we don't truly understand how intelligent they are until like you see how they internalize it. Or you're just it blows me away every time. And like with my daughter who's 5, like the stuff that she just internalizes being around all these tools, I'm just blown away every single day.
Yeah,
Yeah.
you're doing such a big thing where you're desensitizing kids to things that would normally be really scary, and you're
Yeah.
making them fun.
Yeah. That, that brings me to like what happened with my youngest daughter, how she
Yeah.
had HIE at birth and was in the NICU for a couple weeks. And I remember because it was so unexpected, I guess for listeners that don't know, HIE is basically like a brain injury because of my placenta abrupting. So when she was in the NICU for those first few days, she's in a cooling blanket. She had an EEG on her head. She had a CPAP, central line. And for all the adults, like us included, even myself being a nurse, going in there, it was so just intimidating and solemn because I remember my parents coming in and everyone was just so sad and like just being so like tiptoey around everything because they're just
Yeah.
not sure how to act in those scenarios. Whereas Josie, she was 4.5 at the time, she saw every one of those tools either through her coloring pages or through her toys. And when she went in there, she was just excited. Like we thought she was going to be afraid or like be scared to see her sister with all these things coming out. She was like, I know what that is. Mom, you have that. Mom. And she's just excited about everything. So that really
Oh
brought
my
it full
gosh.
circle and seeing like how these can help.
Absolutely. I That word you said, solemn, is exactly matches, like, the feeling of oftentimes in the ICU or the
Mhm.
NICU and really peds oncology at times.
Yeah.
It's so interesting to think how in one room you can have so many feelings of being both solemn and joyful and excited, but that's like the wave of emotions that families ride in the
Mhm.
hospital.
Right. Yeah, and I feel like there's so much we can learn from kids through that too. And like she really helped me get me out of my funk in a way because I was so like in a way like fearful of like really connecting with my new baby Heidi because I was scared of the outcome. Like we didn't even know if she was going
Yeah.
to survive at first. So it was like a really weird thing to go through. But then my daughter just fully loved her fearlessly, unconditionally. And I was just like, duh, like, like I need to get out of my funk. Like, what is going on here? So yeah.
Yeah, kids are doing it right, and they're teaching us along the way, which is one of my favorite parts of being a child life specialist and a parent, really.
Yes. Yeah, absolutely. Being in peds oncology too, I feel like it was a lot of people think it is mostly like solemn and sad, but the truth is the kids that are in oncology are healthy otherwise. So they are so happy usually on those floors. Like they just push through, they're playing. Like I feel like if you go to a peds oncology floor versus adult oncology, the difference is wild because adults, we like to say, woe is me, and like really, like, I don't know, just not push through as much as these kids. The kids are so resilient. Yeah.
They're ready to get out and play.
Yes. Yeah. I love it. And that was my first experience with child life too. So that is kind of what got me falling in love with this whole field.
I love it. I love it. I'm so relating to what you're saying about like kids being able to play on a unit like that. And one of the remarkable things I think for parents is what you just echoed with your experience with your daughter and then having Josie come to visit. But when parents are able to watch their kids play in a solemn or really a situation that's out of their control, it does do something chemically to the parent's brain to like put them back in the moment
Yeah.
of like so many anxious thoughts, so many unknowns, so many variables, so many different outcomes that can happen. But when you're sitting there and you're watching your child play and discover, it truly brings you back to the moment.
Yeah. Yeah. 100%. My older daughter's been in the ER for like a UTI when she was younger. And it's so interesting how just being in that environment, you kind of forget like how to just like help be normal and look at life through the lens of like a kid. And so like
Yeah.
when you're sitting there, like it's all new to you too, even though I'm a nurse, like she is being worked on. I'm like, how do I mom right now? Like, what am I even supposed to be doing? But just playing and being reminded that to play with them and just make things playful is huge. Yeah, it helps everybody.
I love that. And since we're on the topic of play and as a child life specialist, I want to talk about too about like actually observing what medical play can look like. And is there a right way to do it? And is there a wrong way to do it? And I'd love to hear from you like what your thoughts are about that.
Right. I feel like honestly, the right way is the easiest way. It's just like introducing the tools to the kids and letting them explore it. I think that where you start having too much instruction is where people start not wanting to do it and getting hesitations because they think, oh, I'm not doing it right. But there's really no right way to do it. And I think the simpler, the better, just by observing how they work with the tools and like what they say to their steppy when they're doing different procedures on them, you'll really learn a lot about how the kid understands the procedure. So I think that that is the most eye-opening part of medical play is really just seeing what the kid understands, if there's any misconceptions, like if they think when they go to do a pretend flush, if they say this is going to hurt, you're like, okay, note that for later. So we need to talk about how that it shouldn't hurt. So like,
Yeah.
I think that there's a lot of value you get just by watching. So I really don't
Yeah.
think there's a set way.
I love that, and I find so much of like so there's kind of play and preparation, and that's when you're like preparing for an event that's gonna come, or maybe you're processing an event that happened. And that's a great opportunity for the adult in the room, whether it's the nurse or the child life specialist, the parent, to, like you said, observe misconceptions and be able to then, help them understand in a way at their level what's going on.
Right.
And I think it's okay to watch them play incorrectly. And that's
Mhm.
something that can be uncomfortable for us as adults. It's like, no, you don't wipe first. You use the tourniquet first. Like, why
Yeah.
would you wipe if you don't know where the vein is? But then we take away the play aspect of it. So these are really good things. Like you said, make a mental note for later to address that at a different time, but
Mhm.
allow for the play to like flow freely.
Right. I know. And I think that is really the best way to go about it. Yeah.
It's like the classic parent things where it's like we have the best intentions and then I go in and ruin it. Like my
I
son comes to
know.
me with something and he's like, "Mom, this happened." And I'm immediately like, "Well, did you consider their feelings?"
I
Like the other
know.
person. And then
Yeah.
what my son's like, "Mom, can you just stop and listen?" I'm like, "Okay, yes, you're right. You're
I
right."
know my daughter likes to do a lot of imagine play and she'll be like, you're going to be the bad guy and you're going to steal something. And I always ruin it like, but stealing's bad. I don't want to do that. And she's like, can you just play?
It's so
So,
true. I was
yeah.
actually I'm sure you have a lot of these stories, and I would love to hear some of them. One that's coming back to me is I did my internship in oncology, and I was doing a medical play session, right, with I think she was probably 4 or 5 then, and we had those cloth dolls. And at the time, I had a cloth doll and a set of markers. And I had some intention or goal of maybe trying to understand her understanding of her diagnosis, which was ALL. So she takes her medical play doll and her red marker, and she just starts drawing red all over this doll's body. And, like, in my head, I'm like, "She totally gets that this is a blood cancer, and, like, this is amazing." So she was playing, and I was looking at that, and I said, "Oh, tell me about what you just drew." And she was like, "Well, those are the fireballs all over my body." And
Oh,
I was like, "Okay, tell me more about that." She's like, "Well, there's the fireball hit here, and then the fireball hit here." And I was like, "Wow, okay. I wonder what that feels like." She's like, "Well, it's not real. It's not actually happening. This is a doll." And I said, "Oh, okay. Do you have fireballs on your body?" She goes, "No, I have cancer." Like,
yeah,
and so it's almost like what I had created in my mind or an expectation. You just have to let go and let them
yep.
play. I don't know if you have any stories like that.
What comes to mind is just like that how play gives kids so much confidence like that. Like how
Yeah.
they're now teaching you. And so this is a very family run business where my sister-in-law's sister lives very close by. So I don't know what you call that in terms of family relationship, but
Sure.
yeah. So her son has HLHS. And so he's actually the one that inspired us to really get the echo and the chest tube drains and get those materials for him to practice with because he was getting a lot of echoes. Now he's post Fontana and he's doing wonderfully. And he does, I think he has like an annual follow up now. It's wonderful. But anyways, so he was like feeling like these echoes were just something happening to him. And it was always just this thing he had to go do. And it was a little scary and unknown. But then after he had the toy echo, she said that he walked in there and start with his little toy echo and was teaching the echo tech how to do it.
Love.
So great. Like how it just, yeah, it gives them so much confidence in what's happening instead of something happening to them. Now they're a part of it.
Absolutely, and it
Absolutely.
makes sense when you translate that, like, even in parenting, teaching them how to put on their own shoes or put on their own pants, and they just wanna do it themselves and
Hmm.
feel competent and confident. And, of
Yep.
course, that translates to the medical experience too, just like you said.
Right. 100%. And that in the work side of things, like pediatric oncology, the moment where I like really connected the dots was I think she was about 3 years old and she, I believe, also had ALL or AML, but she had a teddy bear that she brought with her everywhere. And I was just going in to do a simple lab draw from her central line. And I don't know what caused it. She was a new patient for me, a long-term patient, but for some reason, just the lab draw, what she was having a lot of anxiety and fear around, even though that she already had a central line in place, so there were no pokes. So I went and I got a like a real IV, took the needle out, and then put the IV catheter like on her bear, and was just demonstrating it on the bear. And it like the tears legitimately just turned to curiosity. And she wanted to play with it and she wanted to practice on it. And then I was able to do her draw so easily. And I know for a child life, that's your whole job. But it's interesting because in peds nursing, you don't really get taught how to play. So it's like that moment, it was, oh, why is this not taught in schools for nursing? Like it was a really eye-opening experience and it's why the business is here now.
A
Mhm.
1,000%, and, like, just to be very vulnerable, like, as a child life specialist, especially early in my career, I think I had some ego there that was like, "I have to be the one to go in and do the play," and that
Yeah.
was just the complete wrong mindset to have, and your
Yeah.
mission to provide more tools to encourage everyone to play at the bedside, whether it's the parent, the child, or the nurse, is only gonna really further your mission to reduce medical trauma. It doesn't
Yeah.
have to just be the child life specialist or the nurse. Anyone can do it and really, just like you said, turn from fear to curiosity.
Yeah.
And like I see that a lot in owning a business, and I can imagine you do too, is that when you first have your first idea to create something, there's that innate fear that's like,
Yeah.
you shouldn't do this. There's no way you can accomplish that. How is it going to get out? How are you going to mass produce it? And then you start turning to curiosity and you go, well, what if I did it this way or do it that way? And
Yeah.
I don't know if you feel that way as a business owner. I do all the
Yeah,
time.
I know, and it's really just doing it anyways, and you don't have knowing that you're not gonna have a perfect product to start. Like, when I first started, I was making G tubes legitimately out of clay, like, hand
Yeah.
sculpting and painting them, and then as the demand increased, and then I was thinking how we need to make this more interactive, then we decided to do CAD software and 3D printing, and so it really is, like, one step at a time, and so we had one 3D printer at my house that we were making these on. And now we were in like a 1,600 square foot space with 26 3D printers. So it
Wow.
really is just like one step at a time trying to make the big dream come true.
So
So,
impressive. Well, you're absolutely making it come true. And then, okay, I have one final question. I have to hear about the name The Butterfly Pig and how that came to be.
yeah. So the Butterfly Pig is actually a book, a children's book that I wrote a couple years before the business was born. And I've always just loved the phrase when pigs fly, but not as a notion of impossibility, but more so of defying expectations. And so I just love that image of a flying pig. And I remember just thinking there needs to be a flying pig with butterfly wings because that's just like such a magical creature. So I really just wanted this whimsical creature to exist. And then I also wanted to meld that with the idea of just loving yourself and no matter what differences we all have. So the story is a message of self love and embracing differences. And it ends with you are you and you are extraordinary. So that's like kind of our theme on the business. So once I opened the business and I had this book, I thought, I think we should name it after the book because it's that same message that even though these kids are going through such a tough time, like their unique experience is building them into their unique self and they're extraordinary for it.
I
I
love
love
this so
this.
much, and I don't think there could be a better name. Like,
Yeah.
medical toys for kids just doesn't work when you're actually in the business of play.
Yeah. I know. And like, I'm the farther we get along this, the more I'm like falling in love with the character, the butterfly pig too. Cause even like seeing like with Heidi, with HIE, you see all these and similar to other medical diagnoses. Like when you look it up or when you talk to doctors, there's all these expectations of what they won't be able to do or different limitations because of their medical diagnoses. But being so immersed in this space now, constantly these kids are defying expectations. Like medical care is getting better. Like there's so many improvements happening that these kids are capable of so much. And so it's like the butterfly pig, like it's and just that idea that they can do the impossible.
I
I
love it
love it
so
so
much,
much.
and I'm gonna have to buy your book now and read that to my kids. That sounds perfect.
Yeah.
Well, what is the best way for someone to get started with buying their first thing from the butterfly pig? Do they have to have a child who has an upcoming procedure? Do they have to have had a diagnosis, or what's your recommendation?
Honestly, it's a really unique to everybody. So if they have a child that is already getting medical care, then they can go on our site to thebutterflypig.com and see if there are those tools that help represent their kid's unique medical experience. If it is something like lab draws that they have to prepare for, we have pretend butterfly needles and syringes. So there's really unique stuff that really could help prepare kids prior to getting care or help them during care if there's an upcoming hospitalization coming up, like a surgery, or even afterwards in processing. So it really is beneficial at every step. And if there is something on our that's not on our site, so that's not yet represented, then they can just email me at Mary at thebutterflypig.com and we can put that in our design queue because we're constantly making new stuff.
That's
That's
amazing. And see, I love also how you've like beautifully built this life of yours, like where you get to marry so many of the things you love. And I know it's why you're going to be successful. You're marrying your love of nursing and medical, of play and kids, of being able to be a mom, but also just being really creative and making
yeah.
what you're making your own.
Yeah, I honestly like that is what keeps me going in this business. It's obviously very mission driven, but I am having so much fun with it too.
Mhm.
So I think any other person being in this for 5 years now would be like, why are you still doing this? This is not smart financially. But everybody around me understand and they're all motivated too. And so it's a really good support system and we're having a lot of fun building it.
You're preaching to the choir here. And like so often, like we measure success as financial success, but also
Yeah.
waking up and wanting to create and do better for the world every day feels really successful too.
I know it's like I go to events and family members say, "So are you making as much as you did doing nursing? Like why'd you leave? Or what why are
Yeah.
you doing this?" Like, like why
Yeah,
is it always about money? Like I hate that mindset.
I know.
Yeah.
Okay, so the website is thebutterflypig.com.
Yes.
Okay, wonderful. Well, thank you so much, Mary, for what you do and who you are and how you're bringing so much of your uniqueness to your business into the world and just making the world a better place for especially kids and families going through medical experiences.
Yeah, thank you for having me on.
As a parent, you want to be there for your child, especially when it comes to their health. But healthcare can be overwhelming and confusing. The good news is child life specialists are experts who help families navigate these challenges. But often our support is only in hospitals. So imagine if you had access to these valuable tools and resources all the time. You would be able to understand medical procedures, explain them to your child, and help them feel less anxious, which also makes you probably feel less anxious. So when your child visits the doctor, has surgery, or has a medical procedure, having the right information and support can make all the difference. You, the parent, can be prepared to answer their questions, calm their fears, and advocate for their needs. Child Life Specialist tools are ready to be in your hands right now through our app Support Spot. All you have to do is go to the iOS or Android store, type in Support Spot. We are giving all of our listeners on this podcast access to the app for just $19.99 for an entire year. You are going to have, I'm not kidding, 7 years worth of resources and support and information that we have been building at Child Life on Call at your fingertips. With these tools in your pocket, you can transform the way your family experiences medical care. Parents, you deserve to be informed and feel confident in your child's healthcare journey. And by having access to Support Spot, you can ensure that your child feels supported and understood no matter what medical challenges come your way. Head to the link in the show notes or go to your app store, type in Support Spot to download it today. For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you and they may not be right for you. So, the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So, regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So, please keep that in mind as you listen today.